What I perceive as the sort of typical clinic. So, you know, I had an 85-year-old woman come in about 3 years ago. Her husband's in sort of year 4 Alzheimer's, and she said, you know what, Mike, I can't leave the house so much. She had come to me through Emerge. She was on 10 medications. We were sort of just weaning down her medications, and we sort of figured out her problem. And so she said, can I just email you? And when a 84-year-old says, can I just email you? You kind of have to say yes. So, so we launched this email clinic, and it's so interesting because I actually think it's sort of how care changes, it doesn't. So what doesn't change is I have to have that relationship with the person. Do you know what I mean? And so when I email them, it actually makes our relationship better. So if I saw somebody with a chronic disease, you know, 8 times last year, this year I see them 4 times, but we have 8 emails kind of thing. Do you know what I mean? And so it's a better user experience on both sides. And my point there is medicine changes and doesn't. So the relationship is still paramount, I think. But if the technology can make that better, that's when it seems to work. And just going out for dinner last night, it seems like Group Health Cooperative is a leader on that kind of stuff. And we were talking about broadcasting. And this is a big thing for us. So we're building programs around exercise and better life and dropping them into our email clinic and sort of broadcasting it to patients. One of the people in our group runs an HIV primary care practice, and so she has a very specific population that she broadcasts to, and so that field is always changing, and so she'll broadcast that. And it's just interesting how the relationship changes. And clinicians, of course, you know, in Toronto, we've switched so the patient can see all their data. And the clinicians were the biggest problem there. They didn't want that to happen. And so, not that they didn't want it to happen, but they were most fearful of it. And when it happened, of course, it was fine. But, you know, I write SOB on an x-ray, and I mean short of breath, and my patient thinks something else. So, there's lots of interesting things to figure out here, but it's just about to snap, I think, and change.